Diolch, Llywydd. Trefnydd, I'd like to request a statement from the Cabinet Secretary for Health and Social Care regarding the current state of dermatology services in Wales, with particular reference to waiting times and access to treatment. Now, in the Hywel University Health Board area, the situation is especially worrying. The average waiting time for patients to begin treatment in dermatology is now 22 weeks. Even more troubling is the fact that, according to the latest figures, 10% of patients are waiting 62 weeks or more from the point of referral to the start of treatment. Now, behind these figures, there are people across West Wales who are experiencing prolonged discomfort, anxiety, and in some cases, worsening health outcomes due to the lack of timely access to care. Given the prevalence of skin conditions, including skin cancer, and the importance of early diagnosis and intervention, this is a matter that demands urgent attention. Therefore, Trefnydd, I'd be grateful if we could have a statement from the Welsh Government which outlines the immediate steps the Welsh Government is taking to support dermatology services, reduce waiting times, and ensure that patients across Wales receive the timely care they actually deserve.
Diolch yn fawr, Paul Davies. And of course, you know the progress that is being made in terms of reducing waiting times, the investment that has been made, and expectations that the Cabinet Secretary for Health and Social Care has of the health boards, and of course that Hywel in your constituency and region, and of course the importance of dermatology access to treatment is vital and recognised.